Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity here in Southern California. We are a group of licensed physicians, physician assistants, healthcare providers that practice functional medicine. I myself have been doing it for about 43 years. The other doctors, quite a chunk of time. So we have a lot of experience. And so we do this Ask the Doctor Anything, a time where you, your family, your friends can ask us any question to find out how we would approach a symptom complex from a functional mindset as a standard trained allopathic physician. Some of our physicians are also naturopathic physicians. And so we meet here on Tuesdays. Happy voting day, by the way. This is election day. Hopefully all of you voted already. Anyway, so the long and the short of it is we try and do this so that you have an opportunity to ask questions and see how we would think about how to take care of your health in a preventive functional way. At the same time, looking at the standard medical approach and working together, if necessary, with consultants towards the greatest end, which is your health and preserving that. So we'll start with, we are not trying to do this as a treatment over the YouTube. This is just to be a general educational response. If you have a serious problem or you have a question and you have your healthcare provider, you need to bring it to their attention. But in the meantime, we'll just give you some of our thoughts as we look through these questions. You can get these questions by going on our website, tlcdoctors.com, tlcdoctorsplural.com, and you can then get on our newsletter, our website newsletter, sign up, and then we'll send you a notification when we're doing this as a reminder. And there's a link on the reminders of where you can type in a question. And then that's how I get my list of questions that are given to me at the end of a day of work. I will be going afterwards and doing my workout with my weightlifting with my husband. I do that 3 times a week. So we're trying to do the things that we're recommending. We are not perfect, but we are certainly trying to do all the things that we would advise our patients to do. Another way you can ask questions is here on YouTube. You can type in the chat. You can put in a question there for our live audience as well. And so if we're going to restore the republic and rule of law, we want to be healthy and we want to be able to live long and give our experience and our loving wisdom to the younger generations and help them build the American dream for everyone. And so let's begin with our questions today. The first one I have is from Josie. And I guess this was from last week because I didn't finish all the questions last week. So some of these are going to be from October 24th, a week ago. And Josie says, I'm 58 years old. I fell down and hurt my right hand. My 3 last fingers are very swollen, but not broken. I went to an orthopedic doctor, and all he told me was to take 2 Aleve a day. That has done nothing. I cannot bend these fingers all the way to make a fist. What do you recommend? Thank you. Well, Josie, I assume it's your right hand, the last 3 fingers. Maybe you hyperextended it when you fell and you sprained it, because obviously if you went to an orthopedic doctor, you've probably had an evaluation, possible x-rays, but apparently no fracture is thought to be there. These soft tissue injuries and ligamentous strains take time, especially the older we get. What I recommend whenever I injure myself or I'm with my patients, upon any injury, I stop eating. I just don't eat for about 24 hours. And during that time, inflammatory markers go down, so the degree of inflammation wherever the injury is will be reduced. I take systemic enzymes like Vitalzyme, Vascuzyme, or systemic enzymes. And I take a lot of them with an acute injury. I'll take 6 or 8 on an empty stomach, twice a day for sure, maybe even 3 times. I take my multi-minerals, my B vitamins, B methylated complex for stress, and I just won't eat. And so my body will take its time to reduce the inflammation. As difficult and painful as it is, if you're acutely swollen, you won't be able to, because the swelling will limit your range of motion. But doing as much as you can to move and put your hand through the range of motion and your wrist is important for circulation. And then, of course, water, plenty of water, half your weight in pounds. So if you're 150, you need 75 ounces of water or 80 ounces. So that's what we do for acute injuries. And of course, if the swelling doesn't improve, you have to follow up with the orthopedic doctor. But that would be my recommendation. I presume that this is within a few days now already, since you've seen the doctor and followed up. But do those things until you're feeling better, like 5 3 times a day, 6 3 times a day, with the first 24-hour fast. Then as you're improving, you can drop it to twice a day, and then after a few more days, once a day. But I would always stay on 4 or 5 for about 2 months, because it takes that much time the older we get. The next question also is Josie. She said, do you recommend Ozempic, semaglutide? This is a GLP-1 inhibitor, to lose weight. I'm not a diabetic. The answer is no. And the reason why I do that is because this is messing with hormone receptors for insulin management and other central nervous system brain barrier crossing impacts. And we're seeing that weight loss is now turning out to have significant muscle loss. So that, let's say you lost 10 pounds or you lost 20 pounds, half of that as much can be just in the muscle. So no, I'm not going to support any of the semaglutides or the GLP-1 inhibitors. There's a GIP, which is another receptor site, which is inhibiting the insulin response, glucagon response to the pancreas secreting insulin. So we are for exercise, for not eating late, for a lower carb diet, because we're living in a carbohydrate pimping society. Hopefully that'll turn around if we can start getting control of the deceitful lobbyists that control the American Dietetic Association's recommendations. And these lobbyists from all the food industries pay off, unfortunately, corrupt leadership in our Congress that protects this industry to pimp to our schools, our hospitals, our service members, food supply, these high carbohydrate, high fructose corn syrup, fat promoting diets. So that's what we need to do. She says also, I take 2 Vitalzyme every morning on an empty stomach for inflammation. Is that enough? Josie, well, right now, if those are your fingers that are sprained, absolutely not. And I had mentioned for the fingers, you need to go to 5 or 6 on an empty stomach, at least twice a day, if not 3 times a day. I would do a 24-hour fast to jumpstart the whole anti-inflammatory process with enough water. I always take for myself 5 once a day. I just always do that. That's my routine. And I just don't have any joint pain in my 70s. And I do all my workout and stuff. So we thank the Lord for that. Josie also says, what natural supplements do you recommend for bipolar 2 disorder? My 23-year-old was diagnosed as and is taking olanzapine, which is Zyprexa, 10 milligrams to start. He is extremely depressed and anxious, no energy. Thanks. Zyprexa is a atypical antipsychotic. It is um, having some impact on the 5-HTP dopaminergic receptors. There are many side effects with this. There could be tardive dyskinesia because blocking dopamine receptors antagonistically can create these kind of central pyramidal kind of neurological symptoms. Some people have that as a side effect with certain drugs, like anti-nausea drugs. They can have an acute tardive dyskinesia episode. There are many other side effects to Zyprexa. We are in a world that is looking to the doctor as a solution, looking to the government, the state as solution. We need to, and I come from a worldview of being a evangelical Christian. I turn to God for my sadness, my hurts, and I bring my body into subjection. I try to exercise. Like, you think I want to, at the end of a full day and busy working, go weightlifting? I don't want to per se, but I know I must. And exercise, it has absolute benefit with mood elevation and well-being, healthy, multiple effects, sleep enhancement, um, uh, and as well as other metabolic effects to reducing the blood sugars. So people who are depressed and anxious, they have to be surrounded with your unconditional love and support and encouragement. Go on a walk with him, go to the gym. Weightlifting in particular has a tremendous anti depressive effect. Drinking enough water and getting away from sugar drinks, taking vitamin D, high dose vitamin D. I would get his level, but I think he should probably take 50,000 units of vitamin D a day for 5 days and then drop to 10,000 a day. Vitamin D lifts up the mood. Another thing that helps the mood is the methylated B complex. These are very valuable in helping with mood disorders. The late Abraham Hoffman was a psychiatrist who really started orthomolecular medicine in the late 60s, 70s, and he promoted as a psychiatrist high dose methyl B complex, especially vitamin B1 thiamine, maybe even up to doses as high as 500-600 milligrams. And some he even there is a Derek Lonsdale, Lonsdale, Lonsdale medical doctor out of Cleveland Clinic that would go up to as high as 2,000 milligrams of vitamin B1 to lift the mood naturally. Yeah, Zyprexa can't be stopped abruptly. It has to be tapered. There's many side effects. And this is how we would approach it. Of course, every situation is concerning. I don't know your son's natural state of mind and where he's at, but these things need to be brought to his care. Rich protein, lower carbs, and healthy fats in his diet will help the brain, and the exercise will help the mood. The vitamin D will help the mood. The B vitamins will help. And I would work along with a good functional medical doctor, along with his psychiatrist. And I think you'll get a better solution that way. Sherry says, I'm a 64-year-old female. My ferritin came back at 104. Is that too high? No, that's not too high. What is the range for ferritin? That would be somewhere around 30-ish to 150 range. So you're right in the middle there. So that's good. When I was younger, I always was too low in my ferritin. Yeah, but that's when you were menstruating. I do not take iron supplements. So 104 is fine, Sherry. We have some live questions here. Carolyn says, I've started my mother with COPD and atrial fibrillation on coenzyme Q10 and N-acetylcysteine. They seem to be helping. Any other supplements I can try? I would definitely give her the methylated B complex, 1 to 4 a day. I'd try to bring her up to the 4 a day. I'd give her healthy amounts of protein and fat with digestive enzymes, and a multi-mineral, TLC multi-mineral would be very, very good. I would do chelation therapy if you can find a way or someone to help her with chelation therapy for both the microcirculation in the lung to breathe better and get better oxygen transference through the capillaries in the lungs that are there, and better collateral perfusion in the heart with her AFib. Jilly says, I sent an email, but will ask here in hopes you can answer tonight. Just started your proven MD phospholipids after an appointment with Dr. Majid. Is it okay to put it in coffee, tea, or bone broth? Yes, phospholipids are fats, and you're not going to burn them or oxidize them by putting them in a hot liquid. So the answer is yes. I often tell people to put it in warm water to help it dissolve, because otherwise, if it's tap water, room temperature, it'll be clumpy. So the answer is yes. She says, Julie goes on to say, thank you. Any recommendations for things to do prior to having to do the prep for colonoscopy? I weigh 121 and drink 64 ounces of water daily, a pinch of salt and minerals in the morning. Let me take a sip. When my husband did his last colonoscopy, he fasted for a couple of days, I'm sure, before his colonoscopy. Nevertheless, the doctor said he really didn't get cleaned out, but adequate water. And I honestly would think that it'd be better to be a carnivore for a week to reduce the bulk of fiber from the fiber in plants and fruit. But as far as a stimulation for bowel movements, actually thiamine is a stimulation. Our natural hormones, estradiol, are a stimulation. The trace minerals in your sea salt and taking TLC multi-mineral will give you the magnesium. You could take the buffered C capsule. You could use 1, 2, 3, 4, 5 of them, and that will help with bowel movements. And what else? I would say that's probably the thing that I would do. All right. Then the next question is, Sandra says, you advised a woman a couple of weeks ago to take some health aids for indigestion. I purchased phospholipids, the SBO Protect Powder, glutagenics, and systemic enzymes. Now, systemic enzymes are meant to be taken on an empty stomach. Digestive enzymes are meant to be taken with food. I'm not sure which you took, because it's the digestive ones that will more immediately help when you eat your food. The systemics will reduce all inflammation. I need to know when to take and how to take how many times per day should I take each of these. She's been on Prilosec, and I'm aware it's not the best medication to continually use, I guess is what her question is. Well, phospholipids are they are these fats that are on the top and the bottom of this cell membrane, and every cell has this kind of dangling and the underside like this, fats. And they're phosphorylated. This top here is phosphorylated and very, very hydrophilic, wanting to be around water. These blobs here are protein receptors, these round blobs. And if you have injury in any part or in your gut, these holes are there. And this is where you can get sensation of heartburn and stuff and leaky gut into your body. So if we give you phospholipids and you eat a rich, egg yolk, meat, fish, chicken, pork, bacon diet, then you're going to give stuff to fill in these holes that are there. That's what the phospholipids are for. So we have been frightened away by misinformation of the medical system, frightening people away for years from eggs and from eating meat and things like this. And yet we're made of it. All of our cells are made of it. So phospholipids help to replenish that. And therefore, the first thing I would suggest to do in the morning to prep your stomach to get ready for a day of use of eating would be to take that with the SBI Protect, which is the immunoglobulin A, which is God's general first immune antibody for the body. As you get it in your saliva and you swallow it down, God helps protect you with that. So the SBI Protect has that immunoglobulin in it. And then what else did she take? Glutagenics is just a scoop you can put in any glass of water for heartburn. The glutamine and other elements in there, licorice and things, help be an antacid. So you can use phospholipid with SBI Protect as much as you like. It's food, it's healthy. But to effect a healing, we usually say morning, first thing, and before you go to bed. That is the general rule. But if you want to do it 3 times a day or 4 times a day, you're certainly welcome to do that. But the glutagenics powder is designed to be a quickie to have for any heartburn. And hopefully you can diminish your dependency on Prilosec. Of course, don't eat late. I mean, I would absolutely stop eating by 5 o'clock and never lay down until 9 o'clock. I would try and have 4 or 5 hours between eating and laying down. Lynn says, hi, Dr. Rita. Thank you for your wisdom. Well, thank you, Linda. It's just, we're standing on the shoulders of everyone before us, so there's no room for us to be proud or haughty about what we know. We're just trying to pass it on, and that's what the show is all about. What are your thoughts on using CBD oil for essential tremors? Well, interestingly, cannabinoids are from like marijuana. This CBD, we have cannabinoid receptors everywhere, even in our brain. So this is not foreign or unusual. And yes, they are calming. So I would say it's not wrong to do. However, you need to repair the damage. Remember the picture I showed you of the damaged membrane? Well, that same damaged area is on the myelin sheath around your nerve. It has to send a piece of information about your movement. So if you are eating a healthy, natural, real food, fish, chicken with the skin on it, meat, free range wild, along with your vegetables and low carb, you're going to get phospholipids to repair those injuries to the cell membrane. The other thing we do a lot to help get rid of essential tremors is the EDTA chelation. You are releasing from your bones, from demineralization, all the lead, mercury, aluminum, uranium, cadmium, arsenic is coming out of our bones past age 40, 35-ish. So not only are we breathing it in and eating it and drinking it, we are auto-intoxicating ourselves. And these free radical cations are damaging the intricate membrane over every cell to protect it, which is a negative ion layer. All heavy metals are cations, divalent, meaning they are 2 charge positive, and they injure these sites on the membrane so that people who do EDTA chelation and lower their carbs and they start exercising and repairing this, eating these phospholipids, either as the powder or the food, this starts to get repaired and there's less injury from these divalent heavy metal cations. And so that's how we would do that. I wouldn't be against you using CBD oil, but again, you're just covering a symptom with it. You're not treating the problem. So we go for treating the problem if we can here. Hayden says, my 21-year-old daughter has two bulging discs on her lower spine for 4 years. The pain is now too much to handle, and she's starting physical therapy again. And the orthopedic suggested trying a cortisone shot. That's kind of like an epidural guided by an ultrasound that might help with the pain. Do you have any other suggestions we could try? Well, Hayden, I would ask you first, what is the weight of your daughter? And even if your daughter is thin, a body mass indice will look and see if she's thin on the outside but fat on the inside, so that her muscle mass that's supposed to hold her up and all the little uh, uh, tiny muscles that are along the spine that help to hold it up, not to mention all the big ones. We would want to see how good her musculature is. And that would be on a body mass, um, you know, assessment test. Exercise. She has to exercise. She has to eat the meat, fish, chicken, turkey, beef, and eggs. Range of motion, Pilates, physical therapy, as the doctor says. And let's see what her weight is, what her inflammation markers are. She needs lab to look at the insulin, the triglyceride level, the fasting blood sugar, the hemoglobin A1C, HSCRP, sedimentation rate. All these things need to be looked at. We need to get her blood type and see if she's inflaming to certain foods. We could do a food allergy, food allergy test to see if a common healthy food she's eating, like eggs, what if she's eating too many eggs and it makes her inflamed every time she repetitiously eats them. So there's many things besides just shooting a numbing kind of anti-inflammatory in a tiny spot, when the whole body system needs to be looked at the same time. So we would come alongside the orthopedic doctor and try and do that for her. Then the next question is Todd. I have a family member who got the Johnson & Johnson CV-19 shot a couple of years ago, shortly after they developed colon cancer. After removing part of their lower intestine, they are cancer-free. We are concerned of lingering effects remaining in the system, though. Is there any way to get the vaccine out? Do you know of a good practice in the Boise, Idaho area? Todd, I would look at acam.org, acam.org. Try and find a doctor who has made the effort to learn more outside of his standard medical training and get some functional medicine experience. And that is usually with the American College for the Advancement of Medicine. It is really the oldest established alternative complementary functional medicine group of doctors since 1972. So it is 54 years old. And it is composed of a good history of teaching chelation therapy. That's what it started over, EDTA chelation therapy. And EDTA chelation therapy is a anion, and the spike protein is a divalent cation positive charge. So the anion EDTA tends to get these spikes and pull them out. And the same with the concept of the graphene as well. So EDTA chelation therapy is very important, anti-inflammatory, improves circulation. Systemic enzymes, I would recommend the Vascuzyme systemic enzyme and or the Vitalzyme. I would recommend the low carb diet, adequate water, and regular exercise, along with adequate sleep, and morning hygiene, getting outside in the sunshine with the sunrise, grounding, earthing in the bare feet for 2-3 minutes, that kind of stuff. But yes, EDTA chelation will work very, very much. I would also use other things like iodine support, vitamin D, and the methylated B vitamins. Just a very good approach. A wonderful antioxidant, and I'm never going to back off on that, would be the Juice Plus series, the fruit, vegetable, and the vineyard. All of these work to prevent clots and have the Juice Plus has the most research on protecting the DNA from damage. I mean, they literally have done studies showing, I don't know, it was 1,600 genes that were improved. So yeah, Juice Plus is what I would do. Victoria says, my daughter is experiencing extreme fatigue and depression. This has been going on for about 3 years. Where would you start with her as far as testing? We are thinking of visiting your center for help. Could this be autoimmune since I was just diagnosed with Hashimoto's? She's always had severe allergies to foods and pets. Well, absolutely, Victoria. I would definitely get her to a functional doctor, find out her blood type, get an estimate of her food allergies, and we can do the skin testing allergies as well. But most importantly, the environment, the screen time, the blue light damage, the light damage, the lack of exercise, the social media judgment and condemnation of body image bashing. And this is really hurting our young people. Again, as a worldview Christian, I feel it's important to look for the unconditional forgiveness and love of the faith of our Lord Jesus, and surrounding her with that kind of youth group and support group. There's many churches that have great youth group and young adult groups that are supportive with lots of outings. Exercise would be very critical, and so outings, getting out there and doing it. Adequate hydration, natural support for sleep, getting vitamin D into her, the thiamine, which is in the methyl B complex. So exercise, hydration, good sleep, early morning sunshine, getting out and getting your feet earthing and grounding with the sunrise for 2-3 minutes, getting into the healthy social networks that have unconditional love and forgiveness, and then go from there and work with a good functional doctor that can try and help her. Rhonda says, is there a natural alternative to Eliquis? Eliquis is a anticoagulant prescription medicine for my 90-year-old father. The independent living facility in Chicago gave him a COVID shot 2 weeks ago. Now both legs are swollen, hot, and painful. A blood clot was found in one leg. Hospital doctors said they have nothing to dissolve the clot. Wouldn't tell me the size of the clot. Appreciate your wisdom. Well, it's in the Chicagoland area where EDTA chelation therapy and Great Lakes started chelation. That's the direction I would go for your father. EDTA chelation, go to acam.org, acam.org, and start EDTA chelation. Get them to drink enough water. Most elderly people are underhydrated, which promotes sticky blood and blood clots. And I would put them on systemic enzymes like Vitalzyme or Vascuzyme, systemic enzymes, to take first thing in the morning before he eats and last thing at night. I would get him up and move, exercise, try and do some physical therapy, weight training, and get him on the vitamin D and the methylated B complex and a multivitamin mineral. These are the directions I would go. GLACAM was Great Lakes Academy for the Advancement of Medicine, and that's the original starting of ACAM, and it started in the Great Lakes area around Chicago. So get some chelation therapy. Now, we have to let the local doctor manage the case, because I don't know your dad or anything, but it's very safe. And I, for many decades, have given the enzymes and all these therapies to patients who are under the care of their local doctors, cardiologists, and vascular surgeons for things like being on Eliquis, and even when they used to be on Coumadin. So it's quite safe to use together. find a good functional doctor, acamp.org in the Great Lakes area. That might help your dad. Michelle says, Dear Dr. Ellithorpe, I have a recurring staph infection of the scalp. It's mostly large raised patches and ridges that are not on the surface, they are deeper, all under my hair. I took 2 months of doxycycline plus a topical solution with clindamycin. I had a couple of months when the infection went away, but it came back. Please help. Well, number one, I would fast. I would eat between, 6 a.m. and noon, and then I would drink half my weight in water. So you have to have the volume of water circulating. I would stay away from the carbs. I would be largely or mostly carnivore like or very low keto. I would use digestive enzymes when I eat, but I would use the systemic enzymes before I eat my breakfast, an hour before at least. I would take 5 to 8 systemic enzymes, and I would take another 5 or 8 at bedtime. And I would use the topical Argentine silver. It's liquid, and I would just soak those areas, those patches, with Argentine silver, which is a antibacterial, antifungal, anti-viral material. And I would probably take quercetin. We have it as seasonal shield. It's called DHIS by Orthomolecular. It's a natural antihistamine, which reduces inflammation. So with a very low carb diet, very low carb, time restricted eating. So most of your day is spent, from 1 o'clock until you go to bed at 9 or 10 on it, not eating anymore, and getting those enzymes in at bedtime and first thing in the morning, exercise, plenty of water, and vitamin D. Get your vitamin D levels up to 80 to 100 range. Then I would think with the Argentine silver and the very low carb diet that we should start seeing progress. And this is usually how we treat all those kind of cases. Let me take a sip of the coffee. The next one is Peggy asks, are you prescribing trizepatide for those of us 90 pounds overweight? No, I'm not, Peggy. And the reason is I am not in favor of messing with these hormones that are intricate in dealing with your insulin and even blood-brain barrier insulin regulation. These medicines are being associated with serious side effects, paralysis of the gastric function, gastroparesis, and many other side effects. Now, if you are having serious issues with weight and related comorbidities like heart disease, diabetes, other vascular problems, serious medical conditions that are related to your weight, you should go to your obesity management specialist and have them try and manage you. But all these other nutritional and low carb, ketogenic like lifestyles, time restricted eating, exercise would be all still appropriate, and they all still are very valid. I just am not going to prescribe something that is I think Eli Lilly puts out the trizepatide. The other one is Ozempic, which is another name from another producer. So everyone's getting on a bandwagon trying to create a drug that is near similar but can be patented. I don't like putting my patients in the race for a new drug for weight loss. I'm too worried about the side effects and the long-term impact. I had the same attitude about these mRNA injections, and unfortunately, for many, I was right, and they were harmed. So please trust and get around yourself a doctor who is caring, loving. They're going to be there for you. We have health coaches now. We have a wonderful set of health coaches that will be very supportive with weight loss. Let's try and stay away from drugs if at all possible. But anyway, I'm not going to prescribe them. You'll have to find another doctor. Um, Megan says, thoughts on red light therapy? Any concerns for someone with autoimmune disease? Thank you for all you do. Well, thank you, Megan. We, yes, support it very much. And infrared is when you wake up in the morning and the red light of the sun breaking through with sunrise. Those long infrared waves can penetrate your skull, your eyes, your clothes, especially if you ground. This red light therapy is very well validated and helpful, but the greatest impact and volume is with sunrise every morning. But I have a red light infrared tent in my bedroom where I can take, go in the tent and undress and then just let that red light envelop me. But it'll never be what the morning sunshine can do for me. No, it will not have any negative impact on autoimmune diseases. In fact, if anything, it works as an anti-inflammatory. Nikki says, I've heard of microdosing GLP-1 Ozempic for health and weight loss. What do you think? Really struggling with my weight. I'm not going to prescribe it. I don't trust it, and I will hold my decision on that. In the meantime, we have health coaches, and we have so many other valuable things. We have to walk through this life. I do too, and say no to the Halloween candy, not a bite. I had to. What I gave for my trick-or-treaters was I get the Juice Plus gummies in individual little packets, and I passed out Juice Plus little gummies to my trick-or-treaters. Not that I endorse the practice of Halloween, but since they're going to knock on my door, I am going to give them something healthy and some information to their parents so that they can learn about it. But we can do this. My patients are the best. And you are so capable of being the example and the wonderful inspiration to those around you. None of us are perfect. We have ups and downs, but the general trend is if you are surrounded by those who are for you with the right trends and coaching and support, you're going to be successful. I have tremendous patience and tremendous patient success. Julie says, I've been taking valcyclovir for 35 years as a suppression intervention for herpes in order to avoid breakouts. Is this dangerous for my body? Is there something else I can use that will work like valcyclovir but not have as many side effects? Yeah, I mean, kidney disease is probably harm to the kidneys from chronic valcyclovir is probably the most well-known side effect. It's not that necessarily common. And there are many others, some neurological effects. And we would recommend the high dose vitamin C, both the IV immune drips. We put in, hundreds of thousands of milligrams of vitamin C that goes right into your body. At the onset or the sense or the tingling of an outbreak, try to come in and get it, or just do it prophylactically. The other thing is taking oral vitamin C more generously, keeping your vitamin D levels up to that 80, 120 range, being very low carb, because anything that stresses you stresses the immune protection system. And high carb diets, we're in a disease producing behavior of eating society, and we have to eat different. We have to live different. We have to restrict our treats to the appropriate time and place and reason. So we want our sugars low. We want our hydration with water up. We want our systemic enzymes for inflammation to keep our inflammation low. We want our vitamin D up high. We want our zinc levels up. So the TLC multimineral would be very valuable. Oral vitamin C, the antiviral quercetin, 600 milligrams. That's all I used for the entire pandemic, and I never got sick. So 600 milligrams of quercetin works as a wonderful and has anti-viral, anti-cancer, and many other benefits. That's what I use instead. So there's many things. So Jill, find a good functional doctor that has a swath of knowledge on these things to help you. Maybe can give you some of these IVs. We have some new questions. Carolyn said, would DHIS help with COPD and phlegm? Most definitely, Carolyn. Yes, I use DHIS all the time, every day for almost 35 years. June says, hi, Dr. Ellithorpe. What do you think about keto diet for preteen children with high blood sugar and insulin at most recent labs? And are exogenous ketones helpful? Preteens, yes. They can eat the low carb diet, absolutely. And the ketogenic diet is very fine. Exercise, get them out there, get the sunshine on them, get them off and put restrictions on their screen time, get them in bed early, get them in their bare feet running on the beach with the water or the grass outside. All these things will help them, and I'm very much in favor of it. Are exogenous ketones helpful? I would just deal with a low carb diet. Sit down with them, tell them the dangers, have them watch a video, have them watch the sugar, the bitter truth, and how dangerous these sugars are. Or you could find some other video on the trouble with our highly processed sugars. Tiziana, hi Tiziana, hi Dr. Ellithorpe. At times, patients usually over 60 complain about cramping with exercise and or at night. I always promote low carb diet, water, and taking good mineral. Can you elaborate on this? Yeah, the older we get, the more tired we get, the more break down the rate of cell damage. I mean, the number of cells in your body that are going to start looking like this increase with age, increase with any acute illness in anybody, no matter how old they are. So these injuries are there. And the American diet, the high carb American diet, the lack of drinking water would probably be the biggest thing. I would say the number one thing for pain and inflammation is water. And you can't just say, all right, one day I drank enough water and the next day, I did a little bit. Look at, you have to be consistent. You don't drive your car somewhere and say, I'm going to watch the stop sign today. Tomorrow I won't. I'll follow the road signs today. Tomorrow I won't. No, you guess what? Our health, our well-being has to be as important as the speed limits, the stoplights, the stop sign, the warning signs. That's why water, half your weight in pounds as ounces every day, is the number one thing for cramping and stiffness and aches and musculoskeletal problems. Then would be the minerals, the multi-mineral that will have a plethora of the potassium, magnesium, calcium, and so forth with it. And then systemic enzymes. That's what I would say, Tiziana. Please, please, please don't let your clients get away with saying, I am drinking enough water. I've been doing this 43, 44 years. We are not doing it. We are not. We're being drawn away to too much coffee, too many Slurpee drinks. I'm not for any of these protein shakes or smoothies. Zero. I am for eating real food, 2 to 3 meals a day, period, never eating late, drinking enough water, and going to bed on an empty stomach. That's what I am for. So thank you for bringing that up, Tiziana. God bless you and your patience. The next question is, Julie says, I suffer severe motion sickness. In order to fly without getting extremely sick, I use the scopolamine patch. And that is kind of like those, the other patient's question on Zyprexa, which acts as a anticholinergic. It acts like a, a central nervous system mood calming agent. That's what scopolamine is. The side effects are awful, leaves me feeling very groggy and out of it for 24 hours. It gives me restless leg syndrome. And that's maybe some of that tardive kind of dyskinesia, anticholinergic, um, NM muscarinic nicotinic effect of the cholinergic receptors. Yeah. So syndrome gives me restless leg syndrome at night. I wear it when I go to sleep. Is there anything else you can recommend? Well, that's a difficult one. Being hydrated, being super duper hydrated. Even if you have to get up 5 times on the airplane flight to go and pee, I would drink half your weight as pounds as ounces every single day. Number two, anti-inflammatory enzymes. Number three, I would eat a rich fat diet in the sense of phospholipids, meat, egg yolk, chicken with the skin on it, roasted, wild, free range, of course. Butter, you could put butter in your hot tea, sip that on the trip, drinking plenty of water, taking systemic enzymes, being on an empty stomach, trying to put, if you're on the trip, put on music or something you're very interested in accomplishing so your mind is focused on something other than the fact that you're on the travel. Exercise very aggressively before any trip and exercise after the trip. But the enzymes and minerals, take a good multi-mineral and salt your water a dash with the Himalayan salt. These are the only things we know of. There are those who would say the same quercetin would be a nice antihistaminic kind of action. 600 milligrams, that would be 3 of the seasonal shield dehist. That's what I would recommend. But those are challenging things. All right, Jill says, I just started on proven MD phospholipids. Is it okay to mix in coffee? I think we did this one already. Yeah. All right, Sally said, I would greatly appreciate any supplemental recommendations for the treatment of side effects of chronic diarrhea up to 10 times a day and leg cramps from daily oral chemotherapy and monthly immunotherapy for treatment of HLRCC, which is a renal cancer, hereditary leiomyomatosis, renal cell cancer. Yeah. My close friend is a GI doctor, is having success with treatment, but unable to manage the side effects. Yeah, Sally, the bodies, we have very similar bodies. Yes, we do have different blood types. Digestive enzymes with eating, the phospholipids, I would take this. Number one, I would fast before any immunotherapy, and I would fast before taking the oral chemotherapy, and it has better effects. Then, after taking it, you could use the phospholipid powder mixed with SBI Protect in a warm solution of like an herbal tea. Ginger would be calming. Take with that also the multi-mineral, TLC multi-mineral. Take also the systemic enzymes for inflammation. Make sure that this person is drinking half their weight in pounds as water every single day, if not more, and on a very, very low carb diet, and that their vitamin D level is in the 80 to 120 range, and have them check with their doctor on their liver enzymes. Now, I've never seen anyone who can't tolerate it. I have many patients who have cancer who we treat to help their immune system, and they're on vitamin D, 15, 20,000 international units a day with vitamin K2. The other thing is melatonin, often during the daytime. If there is a YouTube called Dr. I think his name is Casey Perlva, Pearvle. Pearvle. Casey Pearl. And if you go on YouTube and put in mitochondria cancer and Dr. Pearvle, you'll see all this data on uh, fighting cancer with adequate vitamin D, adequate melatonin, the ketogenic diet, adequate hydration, systemic enzymes. He does a very good job. So that would be great. But I would use the phospholipid powder mixed with SBI Protect. I would use digestive enzyme with eating. I would use systemic enzyme on an empty stomach twice a day. And that should greatly help this person tolerate it with the TLC multi-minerals. Charlene says, thank you for your wonderful service. Well, it's my pleasure, and it's just something woe unto me if I didn't pass on what I've learned from many other wonderful people before me. So I am 60 plus, strict carnivore now for 3 months. Good girl. I've lost about 20 pounds. Wonderful. And I need to lose at least 3 times more. That'd be 60 more pounds. Will fasting cause my metabolism to slow down, impeding weight loss? Yeah, there are steps to this. There are steps. And so I would be eating your um, uh, calories of protein and fish and eggs and chicken and pork and maybe some non-pasteurized, non-homogenized dairy. And I would keep my caloric number up to probably, 1,400 calories a day. So you don't get this metabolic drop in your metabolism. So I would do that. And I would exercise with weight training, which I will be doing here very slowly. So pray for me and my joints. Anyway, all right, so I usually eat from 8:30 to 2. Good, that's the right time. I'm hoping to stay on this carnivore diet a long term. I think it'll be great. I go strict carnivore sometimes, then I add in vegetables, and rarely ever a grain for a treat. So I think it's a wonderful way to live. And she says, I like the results so far. Well, good for you. I'm proud of you, Charlene. Take care. Carol says, dearest Dr. Ellithorpe, is there any way to improve neuropathy, which my son is struggling with? Thanks very much for this forum. Absolutely. The neuropathy will improve with everything that I've listed. EDTA chelation, number one, improve the microcirculation that's around the myelin sheath of these nerves so that it can bring healing to any of these damaged areas in the fatty lining of the nerves. Very low carbs, systemic enzymes, the methylated B complex, the systemic enzymes, never eating late, doing exercise 3 times a week, getting up in the morning with the sunrise, let the infrared light enhance your whole body electrochemically with your bare feet, no matter, it was pretty cold this morning, barefoot. Do all these things with EDTA chelation therapy, systemic enzymes for inflammation, healthy fats to repair the fatty myelin sheath, multi-minerals to enhance the electrochemical signaling, because God uses minerals as his pots and pans to create a template for cofactors to make things. Yeah, that's what I would do. Brian, I am 65 in relative good health. About 6 years ago, I began experiencing cold hands and fingers, usually from October to April. My fingers get numb, the skin between my nails and second knuckle become brittle and darken. The nails get weak and crack. It seems that blood flow is poor in this area during the colder months. Any recommendations? What do you all think I'm going to recommend? You need circulation. You need the microcirculation to your extremities, which is the most distal area where the blood flow is going to go to. You need enough adequate hydration. So you need EDTA chelation therapy. Half your weight is pounds of water every single day. You need the minerals, multi-minerals. You need the systemic enzymes, anti-inflammatory. you need the methylated B complex. I would ask you to see a good functional doctor, get your blood type. It could be that they could do some testing for food allergies. You may be eating seasonally foods, more sugars and grains as the holidays come when most of your symptoms show up, and getting inflammatory reactions. Raynaud's phenomena, Raynauds, is a phenomena where you get vasoconstriction from these allergy responses, inflammatory responses. So we would recommend that you do eat ejaculation, lower the carbs, get your food allergies, find out your blood type, see a good functional doctor, and go from there, Brian. And with that, I think we have hit the mark at 7 o'clock. I'm on time, and we'll say, God bless you all. God bless the USA. And may you all be successful in being a beautiful light and example to your family and friends, helping them to have robust health. Okay, take care. See you next week. Bye bye.